COVID-19 has torn across India with a deadly ferocity. While infection numbers have dropped from their horrific peaks last month, more than 120,000 new cases were reported today. While Prime Minister Narendra Modi announced that all adults in India will now be eligible for vaccines. Slow rates of inoculation help the disease spread. But all the while, immigrants from India here in this country and Indian Americans have raced to help friends and family back home. Here are some of their stories in their own words.
My name is Divya Balakrishnan, and I live in Sacramento, California.
I'm Vineet Singhal, and I live in Austin, Texas.
My name is Shamli Badgayan, and I'm in Cambridge, Massachusetts.
My name is Priyank Lathwal, and I'm in Pittsburgh, Pennsylvania.
My name is Madhushree Ghosh, and I live in San Diego, California.
Hi, I'm Sean Jayachandran. I live in Belmont, Massachusetts.
Last summer, my maternal grandfather passed away from COVID. The hardest part for us was not being able to appropriately say goodbye to him. And then just over the weekend, there was a need for an oxygen concentrator because we were seeing the O2 levels for one of my family members go down precipitously. It was a eye-opening experience to figure out a way to get an oxygen concentrator during a time when there's essentially a black market for oxygen concentrators in India. So I feel lucky that my family and I are in a position to be able to do this for the folks in my family who are suffering. But at the same time, I feel extremely, I feel an extreme sense of guilt, but there's so many other folks that don't have access to the same resources and relationships that we do.
My home is Delhi, and just a few weeks ago, we began to see what was happening with the cases surge, to put it lightly. This was the same time that at my school, at the Harvard Business School, everyone was sort of celebrating graduations and vaccinations, understandably so. I began to think of raising a fundraiser for Harvard specifically. I then thought, okay, why limit to Harvard or why limit to one school? Because there's so much strength in numbers. I realized that Priyank Lathwal from Carnegie Mellon was thinking of something very similar. So I reached out to him.
My mom called me last week around 2:00 in the night in India and saying that a lot of her friends were getting infected and they weren't getting basic infrastructure. So I was really worried for them and, I wanted to do something about it. So I put up a page together quickly, within a couple of hours on GoFundMe. I think within 24 hours, it had gained a lot of traction. And that's when Shamli reached out to me.
In just a week, we've been overwhelmed with all the support and enthusiasm from students across the country. We have about 35 student organizations, some focused on South Asia and some broader. I certainly saw a shift within myself as I moved from this state of completely being consumed in the sadness and despair to being able to make this small difference.
Since I started the fundraiser, I've lost members of the extended family. So the emotional aspect of it is something which I don't think I've had adequate time to process through. And I'm just trying to keep myself busy, but I know I'll get back to it at some point and have to reconcile with that.
As a person who's Indian but living abroad, it comes with a sense of helplessness and a sense of, even if I do something, it feels kind of futile. I'm just clicking a few buttons, but, is it actually making a difference? Virtual yoga classes became a way for me to conduct fundraisers and raise money for very worthy causes. The fundraiser itself is sort of twofold. One is garnering the community support and really hitting home that this is an important issue that affects all of us, not only if you're Indian. And the second arm of the fundraiser work is to compassionately as possible, call into action influential individuals and also larger companies that have profited from Indian culture and yogic culture. It is because millions of people around the world are raising their voice that they do more than pay attention and take action.
So WhatsApp groups have been very transformational for us. So I left India in '93, and my first school, the middle school, was St. Anthony's Girls Senior Secondary School. And these are all girls, and we pretty much grew up together. If I showed up in India for a visit, you ping them and the girls would come together. Sometimes they'd bring their own children along. So it's always been a fun place to share entertaining stories of each other's lives. So this WhatsApp group, as well as my middle school WhatsApp group, is now inundated with information on where you can get oxygen cylinders, where you can go for an ICU bed, mental health, and South Asia. We don't talk about it as much as here, in the US. But in India right now, people are just trying to survive. And there are only two ways to do this. Either we acknowledge that that the trauma that people have experienced is going to be multi-generational and do something about it, or we pretend it never happened.
I'm the founder of Crossover Basketball and Scholars Academy. The mission is to impact gender equity and education rates in marginalized communities across India by using the sport of basketball as a vehicle of change. I just got a text message today of a young girl, Ripriya, who's been in our program. She came for 3 straight years. She's waiting on medical school admission. However, her mom had her hours scaled back and now all the way cut. That's going to put Ripriya, and it is putting her in a position of making a hard choice. Do I continue in school where I don't have necessary funding for tuition? We may not have a place to live or food, or do I put that dream aside? For someone like me who had been typically traveling to India over the past decade 1 or 2 times a year, that expectation of going is just so ingrained. So for me, it's, okay, when can we restart this program? And when can I get back to working and engaging with these kids? But for my parents, my dad was born in 1941. We're talking about a man who's older than the country itself. And the reality is, as all of our parents get older, that I'm sure none of them ever think about, this is my last time going to India, but to not be able to even think of a future moment is very, I think, disheartening for them. But I think at some point there's going to be families across the country whose parents are going to pass away here in the US, never getting to go back. And I think there's going to be a heartache that exists that's hard to understand, of like that idea of like not seeing home one last time.